Hi, yeah, my name's Kwiatkowski. I'll just try and share my screen with you. Hopefully you can see it now. Can you see setting up a vaccination clinic?
No, nothing showing at the moment, Adam. Here we go. Yep, see it now.
Yeah. Yeah, I'm going to talk to you today about setting up a vaccination clinic in North Devon. Has it moved on? Can you see the next slide?
Yeah, you're all good.
Yeah, good, thanks. So my name's Kwiatkowski. I'm a GP at Northern Surgery in North Devon near Bideford. I'm also clinical director of Torridge Health Primary Care Network, which is a group of GP surgeries in North Devon. And I am or was an HSMA student from 2020 to 2021. So back in October last year, I started the HSMA course, and round about mid-October, we learned about discrete event simulations, which Dan has just talked about, which are essentially models various queuing problems. Then back in mid-November 2020, the clinical directors of the PCNs got emails from the NHS England asking PCNs to take over the administration of COVID vaccines. So through December 2020, I tried to use the discrete event simulation training that I had to set up a model to help us design a vaccine clinic at the indoor bowling arena at Barnstaple Leisure Centre. So this was not my initial project that I planned to be doing, but it just seemed like serendipity that we had this challenge ahead of us, and that the course could help with it. So there were various challenges associated with this. We had quite a lot of time pressure, not only the speed at which we had to set up the clinic, but we obviously wanted to give as many vaccines as quickly as possible to as many of the population to try to get the immunity up. Also, another time pressure was with the Pfizer vaccines. They came in large boxes which were indivisible, and that they had to be given within 3 days of delivery to North Devon, because we don't have cold storage facilities up here. So we had to make sure that whatever system we set up, we were able to administer that number of vaccines within that time. There were staff pressures. So GP surgeries were busy at the time. It was just coming into winter, and we didn't have any extra staff. So we wanted to use as few staff as possible to run the clinics, to try and make sure the pressure didn't build up too much on our normal work. There was also financial pressure in that the cost, the money that we were being given to administer these vaccines, it was touch and go whether they'd actually cover our costs. So we had to make sure that we had as efficient a process as possible set up. So having decided that we were going to set up a clinic in the leisure centre, we had to then think about what the clinic might look like. And so what steps would there be in the clinic, and what processes would the patients go through in order to get their vaccines done? And then how long would each of these steps and processes take? So having thought about it and read as much information from NHS England as we could find, we decided to try and set up the clinic with 3 separate steps involving 4 separate processes. The first step was going to be a check-in that we thought would take about 1.5 minutes. The second step was the consenting the patient and the clinical assessment to make sure that they were well enough to have the jab, and we thought that would take about 3 minutes. The third step would have 2 separate processes in it. In the third step, we'd have someone drawing up the vaccine and then giving the vaccine, and at the same time have an administration process where the patient's details and vaccine number, etc., were entered into a computer. And so those were to run concurrently. For Pfizer vaccines, there was an obligatory 15-minute observation period afterwards. So that's also built into the model. So having decided how the clinic was going to look and the sort of system that and pathway that we were going to use, we then wanted a model that could help us decide some of these questions. So how many staff did we need, and how many patients could we vaccinate in a time period? And given that number of staff and those number of patients, how big would the queues be that were forming at before each step? And would we be able to maintain social distancing throughout this process? So I used SimPy to develop a discrete event simulation with patients as entities that flowed through the model. I used a log normal distribution for the arrival of the patients and the process duration. And within the model, there were various variables that could be altered to see what the effect of altering them would be. So the various variables were the patient inter-arrival time, how frequently were patients actually being invited to come to the clinic, how long would each process take to do, how many staff were we going to have working on each process, and also how big could we have the queue before each step. And then after having done that, there were later additions that I developed the model to try and make it a more generic model for clinics. And so you changed it so that you could alter the number of processes and steps, and also added in car park capacity as well. And so the model was designed to output the average and the maximum queuing times and sizes for each step in the pathway, and also the percentage of time that each queue for each step was over capacity. Having written the model and tried to check it out, I then published it on Google. I don't know if that's the right word, but I put it up on Google Colab, which is an open source platform where anybody can go to have a look. So I'm now going to try and change screens. So I think I need to stop sharing this one and share a different one. There. Hopefully you can now see the new screen, which is the Google Colab, the actual model. Can everybody see that?
Yeah, that's showing, Adam. Thanks.
So talking through the top bit here is a bit of a spiel about what the model does. So I put that it's designed to model a COVID vaccination clinic. It actually could be used to model any clinic where there's a one-directional flow of patients through the system. And it will predict queue lengths and times for each step, and model car park capacity if needed. It will ask for maximum capacity numbers for the queuing areas for each step, and then output the percentage of time that these are being breached. By varying staff numbers and arrival frequency, a clinic with acceptable queue sizes and times can be designed, and therefore avoiding lengthy waits and overcrowded waiting rooms. And then it puts a little bit as to how the results will be output. So then moving down here, bits where you can put in, enter your details. So you can change the clinic name if you like. It's Barnstable Leisure Centre here. The vaccine name, P stands for Pfizer. So if it's P there, then it automatically includes a 15-minute observation period at the end. If you put anything else in there, it would take that out. Then here's the number that we want to vaccinate. 1,170, that's the total number of Pfizer doses that we got in a box. And then we thought we could probably deal with about 100 patients an hour. So that would be a sort of 12-hour day, roughly, of vaccinating. We altered this and changed this around in order to try and see what the queue lengths would be like. Then there's a bit here where we need to, if you want the car park to be modelled, you put a Y in there, and then you can change the capacity of the car park here. And then this gives the percentage of patients you're thinking will probably use the car park. And then finally, how long it takes to walk from the car park to the vaccination clinic, because that will change how quickly people leave the car park after they've had their vaccination or whatever they're having at the clinic. So then you move on to adding the next parameters. And so here's where you add the number of processes for each that are involved in the clinic. And for us, it's 4. And then here's where you name the processes. So I've named them check-in, assessment, vaccination, and admin. And then here you list the number of staff that you're going to have working on each of these processes. So for our clinic, we decided 3 to check in and 5 for the rest of the stations. And then the approximate time that each process takes. And here you list the step that the process is in. So check-in was in the first step. Then the assessment was in the second step. And then the vaccination and the admin stage were both in the third step. They happened in parallel concurrently. Moving on, this is where you put the queue capacity for each step. So here, for the first step, which is check-in, I put 1,000 because before checking in, people were queuing in the car park, which is enormous. So it could hold at least 1,000 patients. For the second and third steps, that was inside, and I put that there was probably room for about 50 patients there. I've kept the other steps, but because there were only 3 steps, I've kept the other steps at a capacity of 1 million, and that's just a sort of default. Again, this is the final thing to input, because it's a Pfizer vaccine clinic, it's looking for observation area, and in our setup, there was room for about 40 people in the observation area. So that's all the stuff input. Now you need to go up here and run the program, run the model, and hopefully down at the bottom, we're going to be able to see some of the output. Yeah, here we go. Okay, so here's how it's output. So it goes through each step. Step 1 involves the following processes: check-in, and then it gives the maximum time for queuing. So the maximum time anybody had to queue for the first step was only 7 minutes. The average queuing time was 1 minute. The maximum queue length was 13 people. The average queue length was 3, and the capacity, it was over capacity 0% of the time. And then it goes through the rest of the steps, going through the same details. So step 2 says what the process is involved. That was the assessment step, and gives the maximum time and the average time, etc. And says it was over capacity 3% of the time. Again, step 3 involved vaccination and admin, and then gave the maximum queuing time again. And then it outputs the same data in graphs down here at the bottom with percentage time over capacity. And so if you decided you wanted to model the car park, it would have separate details about the car park as well, and how busy that was and how over capacity that was. Okay, so that's the model. Now I'm going to stop sharing that and go back to my other one. Okay, so having played around with that as far as the number of patients arriving and the number of staff and etc., we decided to set up the clinic with 3 check-in stations, 5 assessment and consenting stations, 5 vaccine and administration entering stations, and we gave the first vaccines right at the end of December, I think on New Year's Eve. By March 2021, we'd given over 40,000 vaccines. From then, the North Devon District Hospital took over the vaccine delivery, but used the same model in the same place. And so this is to finish off, this is a picture of the vaccine centre. This is the indoor bowling arena, Barnstable Leisure Centre. Patients would enter up on the left here, so they'd be checked in and they'd enter these queues here, and they were assessed here, and then moved on to each of these little table setups. Here is an admin room person with a computer and a vaccine person on this side. And then down at the end was the observation area where people would wait for 15 minutes. And then they'd exit up this side here. And that, I think, yep, is the end of my presentation. So any questions?
Thanks very much, Adam. Fantastic presentation, a really nice demonstration of the model and how that ties into such a fantastic real world system. So I haven't seen any question. Oh, hang on, something's just popped in. So I've got a question: how well did the model reflect the actual throughput of patients?
Yeah, I think it was pretty accurate. The places where it predicted that the queues would be biggest, that is where the queues were biggest. So it was essentially waiting for the assessment and the vaccine. And the observation area was never over capacity, so that was never a problem. And so I think it was pretty accurate. I mean, it was the sort of practical aspects that are difficult to model. For example, so when we started, we were vaccinating the really old and most vulnerable, and so each process took longer than it did as the weeks and months went on. So when younger generation came through, that tended to be a bit slicker. And then interestingly, actually, when it got to about 50-year-olds, it slowed down again because they started having far more questions. But yeah, generally it was it seemed to model it pretty accurately.
Thanks, Adam. Got another question. Great presentation. Thanks, Adam. Curious about uncertainty. Did you do any work to quantify error or uncertainty in the model?
No, I don't think I did. I think what tried to I input that. So for each time that we ran the model, you'd actually run it 5 times, and then would take the average of that. And so yeah, by increasing the number of times that you run it, hoping to decrease errors there. But I think other than that, I didn't really look at the potential for errors and all the range that the errors might be.
Yeah, no, great, thank you. With hindsight, are there any extra steps or things you might have included in your model?
I don't think so. I think the steps. So the way we set up the clinics worked really well, and I think that the fact that the hospital are continuing and still vaccinating people with exactly that same setup is testament to that. I think what was difficult was those times are so short, and you're having such a large number of patients through that, half a minute difference in one of the processes could have quite a dramatic effect on the results and the predictions, and that was difficult. And when we started giving the vaccines, no one really knew how long it was going to take because they'd never been given before. So that was difficult. And thinking back, actually, so as far as looking for potential errors, I did try and alter little things to see how much of a difference it would make, how resilient the model was to small changes in the parameters. It was quite sensitive to changing some of the times for each of the processes. So rather than being able to, I think that just sort of heightened awareness to that made us, who were actually running the clinic practically, aware of the fact that to keep an open mind and that we might need to alter things if things did get out of control. And especially when we started, we had extra staff on hand just in case it didn't model it particularly accurately.